Good afternoon. My name is Rachel Vance. My husband Scott and I are the proud parents of an 11-year-old daughter named Lucy. She's back there for the first time this conference. And our son Colin is 15, and he is affected by TANGO2-related disease. We are from Indiana, so a little bit farther north. So this afternoon, we're going to start off with Dr. Chaya Murali, who is a pediatric clinical geneticist in the Department of Molecular and Human Genetics at Baylor College of Medicine in Houston, Texas. She completed her pediatric genetics residency training at Children's Hospital of Philadelphia. Dr. Murali is interested in studying the quality of life of patients with genetic conditions, patient-reported outcomes, and patient-centered research. She also has a passion for creative writing, and she will be joining us via recorded video today. Thank you.
All right. Hi, everybody. My name is Dr. Chaya Murali, and today I'm going to be here talking to you guys about quality of life, illness perceptions, and parental lived experiences in the TANGO2 community. And so I was supposed to be there with y'all in person, but unfortunately I was unable to do that because I went ahead and got COVID-19. So I'm here home in Houston recording this for y'all. I think we might have some time at the end for questions, or I'm happy to share my email address with y'all's leadership, and y'all can email me if you have questions afterward as well. So everything that I'm going to be talking about today is from a paper that was recently published in the European Journal of Human Genetics called Quality of Life, Illness Perceptions, and Parental Lived Experiences in the TANGO2-Related Metabolic Encephalopathy and Arrhythmias. And this was work that was done by myself and my colleagues, all in collaboration. And like I said, everything here is going to be from this paper. I believe this paper is on your website as well. But again, if it's not there, you can email me and I'm happy to share it with you. So brief background, because you guys are really experts in TANGO2 disorder. As you know, TANGO2 disorder is a multi-system disease that impacts affected individuals throughout the lifespan, as well as their family and their caregivers. While the clinical, biochemical, and molecular aspects of TANGO2 disorder are under active study, the psychosocial effects of the disease have not previously been investigated. And so I myself, I'm a pediatric geneticist. And so of course I am very much interested in the clinical, biochemical, and molecular aspects of various genetic disorders. What I'm really interested in from a research perspective is how having a genetic condition in yourself or your family member affects your life and your day-to-day experience. And so that's what I was interested in. And so that's what we set out to study in the TANGO2 population. Our research questions were threefold. First, we wanted to know, what is the impact of TANGO2 disorder on quality of life in affected children, adolescents, and young adults, as perceived by the affected individuals and their parents? Next, we wanted to know what illness perceptions parents of affected children have about TANGO2 disorder. And last, what is the lived experience of parenting a child with TANGO2 disorder? So before we move on and kind of talk about the results, I want to talk to you a little bit about kind of defining the terms that we're going to be using, as well as some of the methods that we use to measure these things. So first, what is health-related quality of life, or HRQOL? Throughout the presentation, you'll see me refer to HRQOL or QOL, and so now you'll know what these abbreviations mean. So first, health-related quality of life is a person's perceptions of their health's effects on physical, psychological, and social functioning. So it's not just your functioning, and it's not just your health, but actually how the health impacts the functioning and how you perceive that. Now, it said the term perception, so you might imagine that quality of life can have different meanings for different people in different contexts. So sometimes it can be tricky to measure, so we have to kind of define how we're going to measure it early on in the outset. There are some studies in the medical literature that show that having a genetic diagnosis lowers your quality of life compared to the quality of life in healthy individuals. On the other hand, other studies show that genetic diagnoses either increase your quality of life or don't even really affect it at all. And there was a recent study that showed that children who had an inborn error of metabolism, which is a genetic disorder that affects the way you kind of process foods and turn it into energy, that those children, if they had a higher disease burden, meaning more severe illness, more severe symptoms, and so on, they had lower quality of life than children who had a less severe disease burden. And so that's, again, the kind of landscape of what we know about quality of life in genetic disorders varies from study to study. And I think it just shows that it's not one size fits all. And so that's why we wanted to study it in the TANGO2 population. As I mentioned, it can be kind of tricky to measure quality of life, and so you might wonder how we did do that. So what we did was we used a validated survey. And what that means is it's a survey that comes out with a score at the end. And that score is kind of well understood to be kind of have a lot of fidelity to true quality of life in kind of real life, and to be able to be compared between different people and different disease populations and so on. And so we used a quality of life measure called the Pediatric Quality of Life Inventory, or PEDS-QL. And we used the parent report for children ages 2 and up. So any parent of a child with TANGO2 who was age 2 and older was able to fill out that version of the form. And then we had a child self-report for any children ages 5 and up who had TANGO2 disorder. Now, the Pediatric Quality of Life Inventory has 4 dimensions. The first is physical functioning, and that's scored on a scale of 0 to 100. The 0 to 100 score of the physical functioning dimension is also equal to the physical health summary score. So there's no kind of conversion that happens, it just goes directly, and that's the same score. Now, the emotional, social, and school functioning dimensions are also scored separately on a scale of 0 to 100, and we essentially average those scores to get the psychosocial health summary score. And so when you see me talk about the results of the PEDS-QL, you'll hear me mentioning both those functioning scores, those kind of dimensions, as well as the summary scores. So the PEDS-QL has a couple of different formats, and you'll see that we use different formats for the parents and for the children. For all the ages, there actually, or for all the reporting groups, the parents and the children, there actually are different forms of the PEDS-QL by age, so toddler, young child, and so on, as you can see on the left. Now, we use those age-specific forms for the parents who reported on their children's quality of life. And there's not too much of a difference between them. It's more just kind of age-appropriate terminology, like what does your toddler play with versus your teens, you wouldn't say playmates, you might say their peers or their friends, things like that. The length of the form is pretty much the same for each age group and so on. So it's not too big of differences. It's more just age-appropriate changes. Now, like I said, for the parents, we use the child's age-appropriate form. For the children, because of what we know about the cognitive function in the children with TANGO2 disorder, and in talking with some of the TANGO2 leadership, like Kasha Morris, we decided that it would be best to use the young child form for all the children. And the reason for that is the responses are pretty simple, and they have simple response options. And so for each of the questions, the children respond not at all, sometimes, or a lot. And they could even point to one of these emojis if they weren't able to communicate very well. And so it makes it quite simple and easy to understand. And so when we look at the results of the PEDS-QL, you'll see that there's a bunch split up by age group, and those are all the parents' reported scores. And then the children are all lumped together as one because we didn't have it different by ages. Now moving on from quality of life, talking about illness perceptions. So illness perceptions, as you might imagine, are the beliefs or perceptions that people have about their illness. And there's kind of a perception, or a theory of illness perceptions that's in the medical literature that talks about 5 different components of illness perceptions. Those include identity, which are symptoms or experiences that you relate to your illness; causality, the causes of the illness; consequences, the implications of the illness on your quality of life or other experiences in your day-to-day life; timeline, the duration of the illness or the evolution of the illness over time; and lastly, control, the ability of your personal choices or your available treatments to treat that illness or cure it or manage it. You might wonder why illness perceptions matter. We all have different health statuses. We all feel different ways about that. What difference does it make, and why does it affect research, and why should we know about it? Well, it turns out that negative illness perceptions have been correlated with lower quality of life, and positive illness perceptions have been correlated with higher quality of life. And in fact, in many research studies in genetic disorders, it's found that even when people have kind of a higher symptom burden of their genetic disease, if they have their illness perceptions that are kind of more positive, then the quality of life is actually not that affected, as you might expect, considering how high their symptom burden is. So really, it's not just the disease itself, it's really how you view it that matters. The other thing that we know is that illness perceptions may affect your adherence to treatment. And so that's important for us as clinicians to understand. And lastly, illness perceptions affect caregivers, not just the person who's actually affected by the illness. And so negative perceptions in caregivers may reflect a higher caregiver burden and predict post-traumatic stress. There's actually also been studies that show that kind of the way that caregivers view illnesses and have an illness, their illness perceptions will then affect the quality of life of the person who is affected by the illness. And so there's all this kind of back and forth. It's quite a complex web that occurs, which is why it's important to understand illness perceptions. So then you might wonder how we measured illness perceptions. We used a survey measure called the Revised Illness Perception Questionnaire for TANGO2. The IPQR is an illness perception questionnaire that has all these different subscales that you can see here. And it's been used in lots and lots of different populations. And the reason that we call it the IPQR TANGO2 here is that we adapted the identity subscale, which is the subscale that talks about the symptoms that can be associated with the illness, specific to TANGO2. The rest of the scale was exactly the same pretty much as most of the other IPQRs that are out there. And when we talk about the results today, we're going to be focusing mainly on the results between the timeline acute chronic and the emotional representation subscale. So all of these here. In general, when it comes to the IPQR TANGO2, all of these scales, for the most part, come up with numeric scores. And a higher score indicates a higher belief in whatever's tested by that subscale. So for instance, if you have a higher score on the personal control subscale, you have a strong belief that you yourself with your actions can affect the course of the illness. If you have a higher score on the timeline cyclical subscale, you strongly believe that the course of the illness is cyclical, goes up and down. If you have a high score on the illness coherent subscale, you strongly believe that you really understand the illness well, and so on. So you'll kind of see how these play out later on as we talk about the results. So then lastly, how do we learn about your lived experiences? What we did was we created a custom open-ended survey with free text responses that inquired about the positives and challenges of parenting a child with TANGO2 disorder, about parents' worries and hopes for their children, about their desired clinical outcomes, and lastly, about their research wish list, what they hoped researchers would focus on. And so we put together this entire survey, and we distributed it first totally online through something called REDCap, which is an online survey distribution tool, totally secure. And we also distributed it in person at the TANGO2 conference in Houston in 2019. Some of y'all may remember me from that conference and me handing out those surveys and asking you guys to fill them out. We gave y'all some preliminary results during that conference, and now we're really excited to give you the full results today. So, talking about results. First of all, who responded to this survey, to the study? So you'll see that we had different numbers of responses for each type of each part of the survey. And the PSQL had the highest number. So the PSQL was, again, the quality of life survey. And we had 45 total responses, 29 that were parents, 16 that were children. Now, across not this particular survey, but the IPQR TANGO2 and open-ended survey, we did ask parents of deceased individuals to respond if they wanted to. But of course, with the pediatric quality of life inventory, we only had living individuals represented. Down here on the age breakdown, you'll see that far and away the highest number of individuals were representing ages 2 to 4, both on the PSQL and the IPQR TANGO2. And you'll see that there was kind of an fairly even split above that age range, with the lowest number being young adults between ages 19 to 25. So here you'll see box plots representing the physical health-related quality of life scores for our respondents. The first 5 boxes are representing the parent reports for different age groups, ages 2 to 4, 5 to 7, 8 to 12, 13 to 18, and 19 to 25. And the very last one, this dark red one, represents children's responses, all the age groups lumped together. And so here you'll see that in general, toddlers tended to have the highest physical health-related quality of life, and young adults tended to have the lowest, and the others were kind of around the same. And children's self-report was somewhere in that same range as well. Going over to the psychosocial health-related quality of life, you'll see that again, toddlers were the highest. And interestingly, young adults were not far behind the toddlers here. And then everyone else was kind of in the middle, kind of in between and around the same, with, again, teens being the lowest. Now, you might remember that the psychosocial quality of life was made up of the emotional, social, and school functioning scales. And so first talking about emotional functioning, you'll see that everyone is kind of around the same range here, not too much of differences, but with kind of the young children ages 8 to 12, and then the teens ages 13 to 18 being on the lower end. When it came to social functioning, similarly to kind of this functioning earlier, the psychosocial functioning overall, Toddlers and young adults had the highest scores, and everyone else had kind of lower scores. And when it comes to school functioning, toddlers, again, are kind of the highest, but they're not that different from the 8 to 12 age range. And you'll see that kind of 5 to 7 and 13 to 18 are quite low as well. So that's a little bit overwhelming, but we'll kind of break it down and talk about what it means in a second here. The next question we wanted to know was whether parents and children viewed their quality of life similarly. And the reason we wanted to know this is because there's lots of studies in the general medical literature that shows that, especially when it comes to rare diseases and genetic diseases, when you ask parents to rate their children's quality of life, if the children are affected by the rare disease, parents will rate their children's quality of life lower than the children rate their own quality of life. Kids are just kind of used to living in their own bodies and they're not stressed out by it the way the parents are. And so there can be kind of, they don't always align. Now here you'll see kind of across the board that parents scores of quality of life are lower than what children themselves have scored on their own quality of life. But that being said, over here, this child-parent agreement that you'll see, ranging from 0.6 to 0.75, that range tells me that even though there's some discrepancy, the agreement is pretty good. It's more than 60%. It's pretty well aligned. And so even though we can't say that parents' report will totally replace the child's own opinion, we can say that there's some overlap here and it's not that far off. Next, we wanted to know, how does health-related quality of life in kids with TANGO2 disorder compare to that in healthy kids overall? And so here you'll see these are the different domains where we had different scores. Here are all the scores in the TANGO2 population. And here are the scores in healthy kids. And you'll see again that across the board, children with TANGO2 had lower scores than healthy children. And these numbers over here being less than 0.001, that tells us that those differences are not just kind of visual and seen by us. They're not just due to chance, but there's a true statistically significant difference between the scores in TANGO2 kids and healthy kids. That TANGO2 kids do have lower quality of life compared to kids who are healthy. Now moving on to illness perceptions, you'll find that the scores on the timeline acute chronic, timeline cyclical, consequences, and emotional representation subscales were pretty high. What this tells us is that parents of children with TANGO2 disorder view TANGO2 as highly chronic, as highly cyclical, as having significant negative consequences, and as having significant negative emotional effects on them. On the other hand, we found that there were lower scores on the treatment control and illness coherence subscales, which seems to indicate that parents feel that there aren't great available treatments to treat the illness or manage TANGO2. And they also feel like their understanding of TANGO2 as a disorder is not very high. When it came to personal control, we found an interesting split where parents of children who were living had kind of middling scores, which means that they didn't feel strongly that their personal actions could change the course of their child's illness. Whereas parents with deceased children had higher scores, which seemed to indicate that they felt like something that they did could affect the course of the illness. It's hard to say exactly why we found this split, but it is something that we noticed. Lastly, when it came to parents' lived experiences, we asked about positives and challenges or negatives of living with a child with TANGO2 disorder, or rather parenting a child with TANGO2 disorder. On the positive side, parents felt like the best thing, or 8 parents told us that the best thing about having a child with TANGO2 disorder was having self-improvement in themselves. So they said, I learned to be more knowledgeable, I learned more patience, I learned to advocate for my child, and those were really positive things for me. 4 parents responded that being part of the TANGO2 community was one of the best parts of being a TANGO2 parent. And 4 other parents represented or told us that having just a child who was very joyous and loving was the best part of being a TANGO2 parent. On the challenge side, parents told us about fears that are totally understandable. They told us they feared their affected child's death. They had fear and anxiety about metabolic crisis. There were concerns about financial and insurance difficulties. And they also felt the burden of healthcare utilization, meaning they felt the challenges of having to go to the doctor often, having to be in the hospital for a long time, and things like that. Now, when it comes to parents' hopes for the future, we asked what they were hoping for their clinical outcomes for the children, as well as their desired research interests. For clinical outcomes, Parents were interested in preventing loss of function and developmental regression. They wanted maximum adult independence for their children. They really wanted effective treatments, and they wanted to prevent metabolic crises and find a cure. When it came to research interests, there's some similar things here, including wanting a diet or a supplement to prevent a crisis. So they're hoping that researchers will look into this. They want a treatment protocol, again, effective treatments, right, coming across to this side too. And lastly, gene therapy, understandable. I told you a whole bunch of information, so I'm going to try to give you some takeaway points that I hope you can kind of boil this down to. In terms of quality of life, what we found was that overall, children, adolescents, and young adults with TANGO2 disorder have decreased quality of life compared to healthy children. We found that toddlers seem to be the least affected, and teens seem to be the most affected, and young adults seem to be less affected than teens. Now, one thing to keep in mind with all these kind of comparisons by age group is that we should take it all with a grain of salt. And the reason for that is because we had pretty small numbers, even though, 20-something individuals with TANGO2 is a pretty big cohort in the TANGO2 population. It's not that big in kind of absolute numbers. And so if you're comparing 13 toddlers versus 2 young adults versus 4 teens, those numbers start to break down real small. And so we'd really have to kind of prove these principles again in a larger population if we want to really believe that they're true. The other thing we found was that parents and their kids generally agree about quality of life, or at least that those numbers are fairly closely aligned, even though they're not the same. In terms of illness perceptions, I think one of the takeaways was that TANGO2 parents perceive significant emotional and practical consequences of the disorder. They feel that they don't understand TANGO2 disorder well, and that the available treatments are not effective. And parents of living children are not certain that their actions can control the disorder. So that was kind of that personal control that we talked about. In terms of lived experiences, I think one of the biggest and most important takeaways is that the TANGO2 community was a source of strength. This is something that really I'm sure you don't take it for granted, and I think it's a really valuable thing in the TANGO2 community, because a lot of other rare disease communities don't have this kind of solidarity, this strength in numbers. And a lot of people with other rare diseases talk about the isolation as one of the hardest things. So it's really beautiful that you guys have this community to lean on. What we also found was TANGO2 parents use a coping strategy called positive reappraisal to see negative experiences in a positive light, which is a sign of effective coping. So for instance, we talked about how when parents talked about the positives of having a child with TANGO2 disorder, they said one of the positives is that my child taught me how to be a better advocate. My child taught me how to be more patient. And so those kind of lessons that you learned were taking something that was hard and challenging and turning it into a positive. Despite these positive things, challenges do remain, including the uncertainty of the disorder, not knowing really what the disorder is and what it does, not knowing how it's going to affect their children's lives in the future, not knowing when a crisis might strike. All these things weigh heavily on our parents. And lastly, parents have a strong desire for treatments. Totally understandable. And it's something that, we continue to try to work on as a research community. Not me personally, that's not the type of work I do, but my colleagues who are presenting to you here. In terms of future directions and maybe what we'd like to do in the future with this work, I think it would be really important to correlate quality of life with clinical characteristics and natural history. So I talked about how kind of we found different levels of quality of life at different ages. Some of it kind of makes sense, some of it really doesn't. So for instance, why is it that toddlers have really high quality of life when toddlers are often the first age group to present with TANGO2 symptoms? They might have seizures, they might have crisis, they might have all kinds of things, and yet their quality of life is really high. So it's going to be important to kind of correlate their clinical characteristics. Maybe all the toddlers that we had in our population, in our research population, were very healthy, had never had a crisis. Maybe that's why they had a high quality of life. We really don't know. So it'll be important to kind of correlate with clinical characteristics as well as natural history, what we know overall about the disorder. And then also, I talked about how parents told us that they don't really feel like they understand the disease. They had low illness coherence scores. Perhaps we can try to improve parents' quality of life by increasing their understanding of the disorder while we continue to search for treatments. And so, we can't deliver treatments right this minute, right now, but what we can do maybe is help improve things in the meantime by helping you understand the disease better. So there's kind of some takeaways that we can take from this research and try to figure out ways to improve quality of life, even while we can't fix the problem altogether. I'd like to end with some acknowledgements. The NIH funded myself and many other folks on this research team with various grants and supporting our research time. So we're very grateful to them. We're very grateful to the Patient-Centered Outcomes Research Institute, or PCORI, who gave Dr. Lalani a grant to create the TANGO2 conference in 2019, where I was able to present this work and start to do this work. And so that's really a source of gratitude for us. And of course, my co-authors, Dr. Lalani, Dr. Azamian, Dr. Miyake, and Dr. Smith, all of whom contributed significantly to this work, the manuscript, the preparation, the recruitment, and everything. And so I'm very grateful to their help, and they deserve the credit as much as I do. And lastly, thank you to the families who eagerly participated in this work. Working with you guys has been really a dream. It's always been enjoyable, and I just love your enthusiasm, and you make it easy to do research. So thank you so much.